My name is Nadine For 17 years, I had been employed as an emergency trauma RN and have worked in over half the emergency departments in Oregon as an agency nurse. I currently am a very hard-working owner of 2 nursing businesses, and I cannot afford health insurance. The story I'm about to tell you is playing out as we speak. A very nice 58-year-old gentleman presented as a patient at the Corvallis Community Outreach Medical Clinic a few weeks ago with symptoms of increasing weakness and fatigue. I happened to be the volunteer nurse that checked him into an exam room. I took his vital signs, a brief history of his symptoms, and noted that he had significantly low blood pressure. He was then seen by the volunteer MD, diagnosed with a virus, and sent for lab work. He was instructed by the doctor to return in 2 weeks for his lab results and follow-up. He did exactly as was asked of him. He returned to the clinic 2 weeks later in decidedly worse shape. In fact, he was very pale and slumped over on a bench. He was unable to hold his body up. I once again checked him in, took his vital signs, and again noted a significantly low blood pressure. He told me he almost passed out several times during his drive to the clinic. This gentleman was obviously extremely ill, and I requested that the supervisor call an ambulance to transport him to the emergency department. He needed a workup and treatment far beyond our capabilities at the community clinic, and he needed it stat, something I do not ever say lightly. What ensued were long back and forth conversations about the bills he was going to incur from the ambulance and the emergency department. A compromise was made and a taxi was called to transport the patient to the hospital. Not in an ideal situation for a critically ill patient. While waiting the half hour for the taxi to arrive, several of us kept him company and watched him closely. My main concern was that he would die waiting for that taxi. While waiting with him, I asked his permission to tell his story to whoever would listen, and today it is you. He did make it to the emergency department and had a full workup. He was diagnosed that day with esophageal cancer with metastases to his liver. Who knows if this otherwise healthy 58-year-old gentleman could have avoided the progression of his cancer had he been lucky enough to have insurance and the ability to access quality medical care and receive a diagnosis much sooner. Usually it is too late. This is a tragically sad commentary. When did we as a country become so morally bankrupt that we could fail to take care of the sick and injured in our communities? When did we decide as a culture to put profits for the very few far above and beyond the health care of our entire nation? As a nurse, I should never have to decide against what is best for my patients because they cannot pay their bills.